So we've seen how Dr. Patwardhan in the 50s developed this procedure, and it has been passed on since then to all of us. It is very well known and practiced in India, though the usage is definitely going down because the threshold of cesarean has gone down in our private practice, etc. But it still has a huge place. And let's look a little bit beyond the shores of India and see what is happening in the Western world and how they look at Patwardhan's video. So let's go to UK first and speak to RCOG, and we have none other than Dr. Tim Darricott, the Vice President of RCOG. He's a senior clinical advisor to the NHS resolution, contributing to a number of maternal programs in UK dealing with maternity training. His main clinical interest is focused on intrapartum care, particularly for obstetric emergencies, operative birth, and improving women's experience during labor. He's the lead obstetrician of the Prompt Maternity Foundation program, and this is the program which develops a lot of material and course materials for emergency obstetric training. We also have with us Dr. Rachna Bahal, who is a labor ward lead at the University Hospital at Bristol. And a very interesting person whom we have is Katie Conthawhite, who is a fellow, and she's doing fellowship of RCOG in the impacted fetal head at LSES. So I was quite surprised to know that there is a fellowship dedicated to this. And if Katie is with us, she is here to tell us what is exactly happening, and she has done a lot of research and study on this in the last 3 years. So we go over and meet this team led by Dr. Tim Darricott.
Thank you very much for that lovely introduction for me and the rest of the team. And I think it's an absolute privilege to contribute to the Diamonds Are Forever series, particularly about Dr. Patwardhan and maybe what we can learn here in the UK from obstetrics in India. Now, Katie and Rachna are going to discuss in a minute why this is a big issue in the UK, and it's really becoming an emerging problem in the UK. And I gave recently an oration in India, the Sakendra Das oration in the Kolkata Society meeting, Bengal Society meeting, and I think there's been a really long history of India and Indian obstetricians contributing key techniques and key interventions to maternity care. And I think one of the things we have to have a think about here in the UK is taking the best of India and the best of the UK and the rest of the world to make the best possible care for women globally. So it's an absolute privilege to work with you all in India, all my friends in India, to present some of the work we're doing based on the Patwardhan's technique, which Baskapal in Bengal helped us understand better here in the UK. And I'm delighted to introduce Rachna Bahal and Katie Conthawhite, who are both doing the real work on this under my very loose supervision. Thank you very much.
Okay, so I'm just going to share our screen. Katie has put together this presentation about the perspective from our end here in UK, and we want to highlight the importance of training in dealing with impacted fetal head, and for this to include Patwardhan Maneuver where required. So we're going to talk about the rising incident and changing risk factors, and litigation Tim has already alluded to, and then Katie's going to talk about training and guidelines development. So there are very few detailed studies into impacted fetal head, and the largest one is from done by Katie under Tim and my supervision, where we looked at emergency cesarean sections over a year and found that 1 in 9 emergency cesarean sections would have some element of impacted fetal head. We defined impacted fetal head as a situation where you cannot deliver the baby with your standard routine maneuvers. And it is 1.5% of all births in the unit. This is anecdotal evidence, but it shows that it is getting lots of media attention where there are injuries sustained from impacted fetal head. 9% of all infant brain injury claims that went through NHS resolution were for impacted fetal head. NHS resolution collates all the data on all babies with brain injuries born at term. So this is across UK data, and it's probably one of the most comprehensive information we would have across anywhere in the world. And then I'll pass you over to Katie, who has done a lot of work on this.
So we started by doing a survey to try and understand what the current practice and training was for impacted fetal head in the UK. And we did a national survey in which 345 obstetricians responded to. And it showed us that impacted fetal head is really very poorly defined. As I'm sure you all know, there's no consensus definition for it. But worryingly, it showed that practice was very variable and there's no standard approach to managing an impacted fetal head in the UK. In the UK as well, vaginal push method tends to be the most widespread technique that is used to assist disimpaction. But there was also an increasing use of the fetal pillow device, which is used to prevent an impacted fetal head. But this isn't actually recommended by NICE at the moment. What was most concerning was that we also learned that a number of techniques are being employed that aren't investigated and are not recommended, such as using forceps to disimpact the fetal head. What was also concerning was how little training there was for it. In the UK, there is a lack of 24/7 experienced consultant presence, and registrars are likely to manage the majority of cases of impacted fetal head. But given that impacted fetal head is often unpredictable, it means that disimpaction techniques are very difficult to learn from hands-on clinical practice alone. And UK obstetric trainees lack the confidence performing technical disimpaction techniques like reverse breech extraction. And there's also some concern that any manoeuvres may be done incorrectly. Looking at the Patwardhan method in UK practice, what was interesting in our survey was that there was a real lack of awareness of it. Many UK obstetricians hadn't heard of it, and only 7% of those surveyed had actually had experience of using it. So why is it used so rarely? Is it about lack of evidence or lack of training? Well, we've had a look at what the evidence for Patwardhan Maneuver is. In 2016, the British Journal of Obs and Gynae published a systematic review that included Patwardhan method, and that said that there was insufficient evidence to support use of Patwardhan method. There were also concerns that whilst there was some evidence to show that it reduced the maternal risks, that the method is technically more demanding. And this feeds into the concerns amongst UK obstetric trainees about not having confidence and training in these technical skills. More recently, in 2019, there was another study that was actually undertaken in Switzerland, showing that actually Patwardhan Maneuver is starting to have increased uptake in the West. And they compared Patwardhan method with vaginal push method. And the outcomes were favourable. So it showed that it was associated with a reduced risk of uterine extensions and postpartum hemorrhage. But as with all studies on impacted fetal head, it's very difficult to power any of these studies to show if there's any evidence of difference in terms of neonatal outcomes. So is it just the evidence? Well, I think there is a big issue with training. So not only is there a lack of awareness of Patwardhan Maneuver, people just in the UK just simply haven't been trained in it. So only 5% of those responding to the survey had had any form of training. And almost 90% of people just simply wouldn't feel confident performing it. We really need to understand here in the West the subtleties of how to perform this technique safely and effectively. And concerns have been raised that the manoeuvre might be performed incorrectly. So if we're going to start taking on Patwardhan Maneuver, we need to know how to do it the right way, and then we need to train people in how to do it the right way. So a little bit on what's happening in the UK. There's a collaboration between the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives and the University of Cambridge. And we're working together to develop a consensus for the management of impacted fetal head at caesarean section. But what does better training look like? Well, first of all, there's been a real focus until recently on this being purely a problem for the obstetrician managing the emergency. But this is a multi-professional emergency. Everybody in theatre has a role to play, from the anaesthetist who might be explaining to the woman what's happening and potentially dealing with any resulting postpartum hemorrhage. And in the UK, it tends to be senior midwives who perform vaginal push methods. And if we're going to continue using them, then adequate training needs to happen. We need to train people using realistic scenarios. And given the difficulty in training people in real clinical scenarios, it needs to be trained for in simulation. And when we're thinking about simulation, it needs to be realistic. And we've developed a new simulator for impacted fetal head that has been validated, showing that it's realistic, useful for training, and is also able to distinguish between junior obstetricians and senior obstetricians. But it's not just about the technical skills, it's also about the non-technical skills. So communicating with the wider team and giving people proper instructions as to how you want any intervention to be performed. So we're currently developing a consensus-driven management algorithm and a toolbox for management. In the next couple of months, we're going to be developing some animated videos that demonstrate how to perform these complex maneuvers. So that is going to include vaginal push method, reverse breech extraction, and Patwardhan method. And it would be really great to learn from the experts in India as to how it should be done absolutely correctly, so we can make sure that we're disseminating the best way to do this maneuver. All of that work is also going to be supported by augmented reality. We're working on a prototype augmented reality tool, which will make the unseeable seeable, so sort of X-ray vision, so that obstetricians and the rest of the team are able to see what's happening inside whilst they're doing any techniques. For the future of Patwardhan method specifically, we would love to develop a research collaboration between ourselves and India. We really want to work together to share our knowledge and improve understanding of the technique. And we do feel that Patwardhan method should be incorporated into training and the toolbox of skills that obstetricians have. And we'd love to include it in our training videos.
Now we go to the United States of America when we say Western world, and the big giant over there is the USA. And let us see what is the place of Patwardhans there. So for that, I have Dr. Tom Gellas. He is the past president of ICOG, professor emeritus in the Department of Obstetrics and Gynecology at the University of Iowa. So over to you, Tom, and let me also give a quick introduction to Aparna Sridhar. Aparna Sridhar is associate clinical professor at the UCLA, California. We know that it is used for a deeply impacted head at cesarean section. So, Tom, with you and your protocols in the USA, you must be facing this quite often. And is there any place for Patwardhan's maneuver in the US of A and your protocols?
Well, thank you very much for having me in this session. I have to say that after we had talked previously about this maneuver, I had to go look it up. And I looked it up and I went to YouTube and I found some very interesting videos, because in the United States, I would say that it is pretty much underused and probably fairly unknown in the United States. When I watched the videos, I noted the several options, especially for the posterior vertex presentation. And I found that when I was watching this, there were several parts of the Patwardhan's maneuver that I used. I didn't use the whole thing frequently, but there were several aspects of each of the different options that I would use at different times. In the United States, I have found that we refer to it as the reverse breech extraction. And in fact, recently our chair had encountered a severely impacted fetal head, And she used a reverse breech extraction, and that was discussed at one of our morbidity and mortality conferences. And it was very good for the residents and many of the faculty to hear this, but it did not have that label, the Patwardhan's maneuver. I think it would be very beneficial to maybe promote some awareness of the maneuver and also promote it in our residencies and with our faculty. And this is especially true in some of the studies that I read, that there is a marked reduction in lacerations, which seems to always be a problem when we frequently push from below and do other non-Patwardhan's maneuvers. And it also does reduce fetal head trauma. So I think it would be great that we maybe get this information to the United States. So thank you.
Well, thank you, Tom. It was great to listen to that. And what I feel is the reverse breech is so much more simpler to do when the back is posterior. But when your back is anterior, the classical Patwardhans, which we do, delivering the shoulders first, followed by the abdominal and the trunk and the breech, that really works very well. And I think Aparna must have seen it in India before she went to the States. Aparna, over to you.
Thank you, Uday, for having me for this conversation. It's always good to come back to, learning about like the roots of like where everything's started for me. So I was a medical student, and I remember seeing the Patwardhan's method as one of the methods to deliver the impacted fetal head in prolonged obstruction of labor. I think after moving to United States, as Dr. Gelhaus said, most of the time for impacted head, the evidence suggests either using tocolysis like nitroglycerine or something to relax the uterus and try to deliver the head, or the push method that everybody tries, which, works most of the times, but sometimes doesn't. And the reverse breech extraction were the most popular 3 methods that I encountered to deliver the impacted fetal head. And, now that I think about Patwardhan's maneuver, and I did go back and review it, it is, as you said, when the back is anterior, delivering the shoulder first, which is the big difference between a traditional reverse breech extraction versus Patwardhan's, would be something probably to consider, as the shoulders are easily kind of readily available at that point in time, whereas, it's harder when the fetus is on the other position. Having said that, one thing that would really benefit is some more comparative research between either reverse breech extraction or push method. There are existing literature that does, compare these methods between maternal complications and neonatal complications, and getting the word out probably also means more rigorous and more research that you can kind of put it out there to the world to see, because majority of us would love to go by the best available evidence, and to popularize a method would be to kind of do more research and publish it, and also present it in international conferences, so that this method does become more popular and more of us can actually teach it and use it.
Thank you so much for being there with us on this show and giving us inputs upon how Patwardhan maneuvers is taken up in US. So this maneuver, Patwardhan's maneuver, which was discovered in the 1950s in India, has yet to find universal usage. But I'm glad that even the West is looking at it and evaluating it. And I have no doubt that it will be the recommended procedure to be followed everywhere when faced with an impacted fetal head at cesarean section. My sincere thanks to Dr. Parag Benivale and Vaishali Benivale, who helped me with the script. I also appreciate Dr. Tim Darricott and his team who joined us from ICOG, and Dr. Tom Ghellas and Aparna Sridhar who joined us from USA for their inputs. We will bring you another sparkling gem very soon from Team ICOG 21-22. Thank you very much, and watch out for the space.